There were a lot of questions on the WhatsApp and Facebook for understanding the influenza virus, that is the HMP virus, that is human meta pneumonia virus. First of all, let me tell you this virus, whether whatever we are hearing about the virus, the main thing is that it shows the same symptom as what is present in a normal influenza. That is, we have cough, we have fever, we have running nose, sore throat, wheezing, shortness of breath, and rash. So, this virus basically is nothing different to what it was there in homeopathy. We basically treat symptomatically and depends on the gravity of the symptoms. That is very important. So, running nose and stuffy nose, sore throat, wheezing will be very common for the virus. Cough with sneezing, and these are very important. And this HP virus, it spreads through direct contact with someone has it from touching things contaminated with the virus. For example, coughing and sneezing, shaking hands, hugging, kissing, or in today's world we can say touching surface or objects like mobile, door handles, keyboards, toys. This can also cause the spread of virus. It is said that whenever you are immunodeficient, like when you're younger than 3 years of age or older than 65 years of age, when your immunity is weak, like you have autoimmune disorder, you are on medications, you have HIV, those are more prone to have this virus infection. Or you are already suffering from respiratory disorders like chronic obstructive airway disease, COPD, or asthma, then it is more. Now, the question would be then, when do we require hospitalization? So when the chest is involved, lower respiratory is involved, and you suffer from pneumonia or bronchitis or bronchiolitis, then it is expected that you should get admitted to hospital. Or sometimes ear infection, otitis media, asthma, COPD may flare up. That requires basically hospitalization. Again, if you see how to diagnose this, the main thing is that swab, or you can do IV fluid, oxygen therapy, corticosteroids. And normally, for virus, there is no treatment as such because antibiotics is only for the bacteria. Okay, for the bacteria. So for virus, there's no treatment, just a lot of rehydration is required, fluids is required. Your immunity will increase by eating a lot of salads, fruits, antioxidants, and this would basically boost your immunity. How to prevent it? Washing your hands, using sanitizer, cover the nose or mouth with elbow while sneezing and coughing. This is very important, as we had seen in COVID also. And don't share, food or eating utensils like fork, spoon, cups with others. And the last thing, consider wearing a mask if you are sick, and avoid meeting people, avoid going in crowd if you are suffering from cough, cold, coraz, or influenza. Remedy-wise in homeopathy, we are very safe that it is more of symptomatic, So every time the first remedy in homeopathy would be the same, and that is arsenic album, that you have learned so many times, every time the same symptom that I'll discuss. Welcome, Dr. Bharat. Sir, I myself anxiety neurosis throughout the day and get severe night and with fear of death, unable to sleep. Has anxiety that how I will cope with my new role as a department got changed. Okay, and have to do a little bit night shift. So having fear and anxiety because of the age. I am 48 years. What are you working as, Dr. Nitin? I was just telling you something about arsenic, so I'll just complete that arsenic and then go back to you. That's because we are in the midst of one more fear that HMP virus will come back. So in arsenic, the most important symptom is thin, watery, excoriating discharge. First, the nose is stopped up. A very important remedy for hay fever. Okay, these are the symptoms of nose of arsenic, and as from the nose it goes to the throat. So throat may what is there cannot bear the throat is swollen, oedematous, constricted, burning, and the patient is unable to swallow. It reaches the throat. Then it reaches the lower respiratory tract. Then you have symptoms of arsenic like unable to lie down, fierce suffocation, and the air passage is constricted, burning in the chest, wheezing respiration, and cough is dry, especially after drinking. So from the nose to the throat to the chest, these are the normal symptoms of arsenic. So we'll go further. Yeah, see, Dr. Nitin, BP office. Okay. So if you have anxiety, and if you suffer from these type of complaint that you have anxiety, you have stress, and you're not able to manage the situation, there are lots and lots of remedies. Okay, you feel that what will happen to you. First of all, you must always understand why did it happen to you. Sorry, why you land up with anxiety? Because nobody is born with anxiety, so you must understand why did you basically suffer from anxiety, the cause. When you know the cause, it is very important to understand then what to do. So first of all, try to identify the cause, that why you are an anxious personality, why is you are related to anxiety, and then you can basically give the remedy. For example, in your case, I don't know the constitution, you are fat, flat, flabby, I don't know. First of all, you must think about first remedy in anxiety is arsenic album. Second, think about Rustox. Patient there. Third, think about nitric acid. Fourth, think about Calcarea. Now, depending on the constitution, how do you react to anxiety? How is your thirst? How is your thermals? What was your SORA? What is your psychosis? Everything, this is very important. But in general, I am telling you these 3-4 remedies, very, very important. In anxiety, you can think about Kalias, you can think of natrum carb, nitric acid, Kalias. You all were there when I took the seminar on warts. I took a seminar on warts also, and just 2 days before I took a seminar on psoriasis. Anybody was there? No. So one symptom, I was going to teach you something about HMP virus, but then other questions are the recurrent gum swelling with pain in the mouth. See, whenever you are treating cases of gums, make sure that you have, make sure that the patient is not suffering from deficiency. So make sure that B12, D3, you check of the patient, and then try to prescribe medicines. In your case, the gums are receding. Okay, so gums are detached from the teeth. There are remedies, very, very important: Silicia, Merxol, Carbovage, and Califos. Very, very important remedies which I have used so many times in my practice and with very, very good results. See, before the receding starts, there has to be inflammation. So if you treat that inflammation first before the receding starts, you'll be able to cure it better. So for inflammation of the gums, the remedies are creosote, phosphorus, natrum, silicia. Okay, this is very important. Before that inflammation starts, SORA. This is very important. And then you can go to receding gums and detached gums, and there are a lot of remedies. Good afternoon, Navjot. Good afternoon, Dr. Vishaka. Yes, fair compression, fat, and yeah, you can think about Calcarea ars, I suppose. You can think about Calcarea ars, Califos. These are the remedies what I can see in your case. Will urgent nitricum? No, as I have anticipated anxiety that. See, argentum nitricum, I don't think will be applicable in your case. Whatever symptoms and whatever type of questions you're asking every time, so argentum would not help. I think Calcarea ars is, you must think about. Arsenic album you must think about, or you can say Kali ars also you can think about. These are very, very common, and you should be able to get results with that. See, it depends on the potency. It depends on if you have acute problems, you must take LM potency. LM potency and repetition will definitely give you better results. Okay. So can we go further for for arsenic further for respiratory tract, or there are a lot of other questions? So I was talking something about the virus, the HMP virus. Let us go for, so arsenic I told you. In arsenic I have told you chronology from nose to the throat to the chest. Now the same is with rust tox. We have, in the climate now basically is, maybe in Nagpur it is chilly climate and cold climate, and we have symptoms of, rust tox. And that's why if in homeopathy, if it is rust tox, there are certain symptoms that you should think about, very, very common to rust tox. Of course, I'm not telling you the symptoms of, pain in the bone as it is scraped from the bone like that. But again, we'll go from nose to the throat to the chest. Good afternoon, doctor. Good afternoon, Lalit. So, no symptoms of rust tox. Sneezing, coryza from getting wet. The tip of the nose is red, sore, and ulcerated. Very, very important symptom of rust tox. Second, swelling of the nose. This is very, very important symptom of rust tox nose. Then you go from nose to the throat. Throat symptom of rust tox, there is soreness and the swelling of the glands. Okay. Second, there is sticking pain on swallowing. That is a throat symptom. As you go down to the respiratory tract symptom of the respiratory tract, the symptom increases. For example, the cough with pain in the throat. There is tickling behind the sternum, and if you have influenza and rust tox, there is aching in all the bones, and bronchial cough in old people, expectoration, small plugs of mucus. This is rust tox. So whenever you're treating influenza, HMP virus, then these symptoms are very, very important. This is rust tox. As you again go to the other remedy, which you must be able to identify, that is phosphorus. Again, same weather, and again if the virus comes, what are the symptoms of phosphorus? Again go from the nose to the throat to the chest symptom. For example, I'll just complete phosphorus, doctor, part, and then we'll go to this. So nose symptom of phosphorus, fan-like motion of the nostrils like lycopodium, oversensitiveness to smell, and chronic catarrh with slight hemorrhagic discharge. Handkerchief is always bloody. That is the symptom of nose of phosphorus. As you go down to the throat, so there are some symptoms of phosphorus throat that you should remember, because before the virus goes from the nose to the throat, you have to give the remedy so that it does not travel downstairs. Of course, if it does, then you have to remember other symptoms of phosphorus. Now, if you go to the phosphorus respiratory tract, hoarseness, throat mein hoarseness, larynx painful. If you clergyman's sore throat. If you go down, then there is the patient cannot talk on account of pain in the larynx. The patient has, it is so painful, the patient cannot talk. How is the cough in phosphorus? Hard, dry, racking cough, and there's a lot of congestion of the lungs in phosphorus. Whole body trembles with cough, and expectoration is rusty, blood colored expectoration. This is phosphorus, and it is mentioned in our books. It is mentioned in our books that do not give phosphorus in low or too frequent repetition. That is important. Okay. And one more symptom of phosphorus, that if somebody is suffering from a viral infection, phosphorus has nervous cough which is provoked by strong odors, or some strangers entering the room, the phosphorus will start coughing. The phosphorus cough is worse in presence of strangers, and worse while lying on the left side. This is the phosphorus chest symptom. So in this way, whenever an influenza patient comes to you, whether it is COVID or HMP virus, you must go from nose to the throat to the chest symptom, and automatically you will get the remedy. Don't try to wait till the infection goes to the lungs and then prescribe. From those only, if you can prescribe, then the remedy is in front of you. Of course, there are other remedies also. Let me take a question, sir. 56 year have cold with nose block, with thick sticky mucus in the nose and throat, with severe dryness of mouth and tongue with no thirst, sir. Very nice. So first of all, we want a remedy which is thirstless. Whenever you are sure that the patient is thirstless, lot of remedies then go out of the repertory chart, my dear friend. So if your patient is thirstless, then it becomes very easy for me also to prescribe. The second symptom is nose block, and third symptom is thick, sticky mucus with dryness of throat. 3-4 remedies that you should think about, very, very important. Thirstless, dryness of Apis mellifica, gelsemium, ammonium carb, arsenic, bovista, very, very important remedy. Then you can think about some rare remedies also, like anyone, rare remedies for this, very, very important. Thirstless, nose block and all. You can think about allium cepa, opium and squilla. So when your case is taken beautifully, Dr. Ram Prasad, the symptoms, the remedy will flow very easily. Fantastic case, and you will be benefited with this remedies which I told you. Sir, kindly also write some medicine which helps in insomnia. I think for insomnia, I have taken a lot of medicine. I have taught a lot of medicines. But if you still feel in insomnia, homeopathy mein a very important remedy that everybody should know and everybody prescribes also, that is passiflora. But the dose of passiflora is very, very important, doctor. In Boric Mathematica, it is written passiflora 30 drops at one time. Normally, if there is a prolonged and a chronic problem of insomnia, I tell the patient to take passiflora mother tincture 30 drops 8 o'clock and 9 o'clock in the night, so he gets a good sleep after 10. There is one more remedy which are basically in a biochemical remedy, Califos. Normally I prescribe Califos 12x 3 times a day, 4 times a day, depends on the patient, when there is a nervous weakness to the patient. One more remedy which is very, very important, that you should remember is Pisidia. Pisidia is a very, very good remedy for insomnia. It causes a calming effect. It causes good sleep. If you read in Clark Mathematica, it is a beautiful written when Pisidia was taken by the author. Before he could finish the medicine, the sleep started. Of course, I have never seen a case when I gave a patient Pisidia and immediately sleep came. It takes time. The dose of Pisidia I give is 20 to 25 drops. The dose of passiflora is 30 to 35 drops. One more remedy to have calming effect and sleep, that is Scholtisia california in potency 6 potency. I give 6 o'clock, 7 o'clock, 8 o'clock in the evening. That's how I prescribe. Okay. So I think it is done. Let us go to again the remedies for the HNP virus. So we have done 3-4 remedies. Now a very surprising Valeriana, yes, Valeriana will help. There are symptoms of Valeriana which you should take care of, and that would also be a very good remedy, Valeriana. See, there are a lot of remedies. Valeriana is called California. Then you can think about morphinum. Then you can think about alfalfa. Then you can think about Avena sativa, ashwagandha. Lot of remedies. But these are the remedies which I have seen in my practice and have given me good results. Next remedy, Nux vomica. Now, you can never think about Nux vomica for this viral infection. But Nux vomica is, again, we'll go same, nose, throat and chest. In Nux vomica, it is stuffed up nose. मतलब नाक पूरा जाम रहता है, especially in the night. After exposure to dry, cold atmosphere. This is a very, very important symptom of Nux vomica. Coryza fluent in day, मतलब sabere in the day it is like flowing water. In the night, it is stuffed up. And alternate nostrils. The coryza is from the यहाँ left से फिर right से फिर left से फिर right से. This is Nux vomica, and one symptom of the discharge is acrid but stuffed up feeling. Means patient बोलता है डॉक्टर साहब मेरे को सर्दी भी निकल रही है और नाक भी बंद है. Means I have coryza also and my nose is closed. This is a very, very important symptom of Nux vomica nose, my dear friends. Again, the same way will go. Then respiratory tract. Throat में क्या रहेगा Nux vomica का? There is tight feeling in the throat. And then chest, cough. Cough. It is said that in Nux vomica, there is sensation as though the chest is torn loose. And the respiration is shallow. Like this. And There's a dry hacking cough, sometimes bloody expectoration. So don't confuse it with phosphorus. Okay. And one more symptom of nux vomica I have seen in most of the patient, that is cough brings on bursting headache. Patient बोला डॉक्टर साहब इतनी खांसी है, so much cough, it is causing headache with pain in the epigastrium. That is a symptom of nux vomica, my dear friends. Hello, are you with me, everyone? So nux vomica, phosphorus, arsenic, rustox, very, very important remedies. Of course, we can't forget one of the very important remedies in our Matermedica for coryza or cough or influenza or any virus, including HMP virus, and that is Hepar sulph. Again, go from nose to throat to the respiratory tract. No symptom of Hepar sulph, very, very important. Sneezing every time the patient goes into cold. In Nagpur, the temperature is, yesterday it was 8.2. Okay, and it is so much cold, and the normal patient starts coughing in the night. You know that it is too cold. Whenever the patient comes up and the says, "मैं जब भी I go out in cold air," the sneezing starts. Hepar sulph. The nose is stopped up when he goes in cold air. नाक पूरा बुझ जाता है ना, the nose stopped up. Hepar sulph and hay fever. Hay fever. In boric it is written, I think 1x potency, though I have never used in my life 1x potency, but it is written. So these are the nose symptom of Hepar sulph. As we go further, throat symptom. What is the throat symptom? Very, very important throat symptom of Hepar sulph. When swallowing, sensation as if plug and a splinter in throat, and the patient starts hawking up mucus. A very, very important symptom of Hepar sulph. One more symptom, when the patient of Hepar sulph is swallowing, the stitches of throat pain extend into the ear. So whenever the patient is swallowing, he holds the ear because there is pain in the ear when the patient swallows. That is Hepar sulph throat symptom. Now go to the respiratory tract, lower respiratory tract. What is the symptom? There is, in Hepar sulph, cough is troublesome when walking. When the patient starts walking, there is a lot of cough. That is the Hepar sulph cough. And it is written that the cough is excited whenever some part of the body is uncovered and the patient takes out hand from the blanket, the cough starts. And how is the cough? Cough is loose, rattling cough in the morning. Like in nux vomica, the discharge from nose in the morning is fluent, but in the night it is stuffed up. In Hepar sulph, loose rattling cough, worse in the morning. What is this written in books? Suffocative cough. Has to rise up and bend the head backwards. Aisa. The patient gets up from the bed and bends the head backwards. This is a very important symptom of Hepar sulph respiratory tract symptom. Hello, I hope you're understanding, everyone. If you are understanding the virus, now the virus is starting to come. We have, I think, 2 patients here also, and everybody is worried and fearful. Don't worry, homeopathy is there. Homeopathy was always there for COVID, and homeopathy is there for this HMP virus also. Hello, everyone, are you there? Or you're getting bored? If you get bored, please tell me. So we are basically now HMP virus we are talking about. कैल्केरिया का आपका यूनिक सिम्टम, खत्री साहब, अगर दूसरा कोई सिम्टम आप, गुड आफ्टरनून डॉक्टर या खत्री, ओके ठीक है, ये कैल्केरिया कार्ब की हम दवाई तो बता देंगे आपको, बट आपके हिसाब से इफ आई आस्क यू कैल्केरिया कार्ब, सो व्हाट सिम्टम्स विल यू थिंक अबाउट इन कैल्केरिया कार्ब अपार्ट फ्रॉम fair fatty flabby? Apart from that, of course, that is very, very important. You must know that. But Calcarea carb, very, very important mental symptoms of Calcarea carb. Okay, so if there are no questions for the HMP virus, we'll go for Calcarea carb. One of my favorite drugs. Everybody uses Calcarea carb at least once in OPD. It's like that. Now it is said that Calcarea carb is mild, timid, gentle. I'll tell you the other symptom of Calcarea carb. Spongia and Econate. Okay, I'll just finish Calcarea carb. Okay, we have question of Valeriana also. Just wait. So Calcarea carb, we understand Calcarea carb is very mild, gentle. It is there, but in Calcarea carb, the patient has gesture of fist doubling. ऐसा ऐसा करता है, क्लिनिक पे आके gestures, makes gestures doubling up the fist in furious anger. That is Calcarea carb. So in anger, how does the patient react? We can give the medicine. That is Calcarea carb. Okay. And biting, desires to bite, bark, चिल्लाता है. That is Calcarea carb. Okay. And desires to spit, थूकता है from anger. And Calcarea carb will have thoughts of murder. So these are the very, very important symptom of Calcarea carb. 4 or 5 symptoms I have told you. I am sure that most of you must not have heard about this symptom. That's why very good that you asked me symptom of Calcarea carb, because normally in Calcarea carb, we always tend to have that type of symptom, fair, fatty, flabby, constipation, perspiration and all. But these are important. So let us go something Dr. Simran says, Spongia. Okay. Aconite, though you know very well. I think everybody knows aconite very well. But Spongia, very good question, because normally in Spongia we have symptoms of cough, dry cough, as if driven to a pinboard, Again, we'll go from nose, throat and chest if we have time. In Spongia fluent coryza, but the Spongia fluent coryza alternating with stoppage, dryness and chronic nasal catarrh. Very, very important symptom of Spongia nose. Simran, I hope you understand that. Now, throat symptom. Of course, in throat symptom, if I don't tell thyroid swelling, I'll not be completing Spongia. So, thyroid swelling तो है उसके अंदर. दूसरा, sore throat worst after eating sweet things. आपके घर पे कोई आया और बोलता है मीठा खा, बोलता नहीं मीठा नहीं खाऊंगा, मेरा गला खराब हो जाता है. Spongia tosta. Sweet thing causes sore throat. And Spongia patient clears the throat continuously. Sometimes sir बंद कर भैया, कितनी बार करेंगे. The Spongia patient clears the throat continuously, and again the same dryness of nose with same dryness and stitching in the throat. As you go forward, cough. Now cough of Spongia everybody knows, dryness of all mucous membrane, dry cough, the chest is weak and the patient can scarcely talk because of the cough, and bronchial catarrh, wheezing in the chest, asthmatic, going from aggression, going in cold air, dryness of the air passage, Spongia tosta. Okay, so Simran, you have to go and read aconite. Now this is a very simple remedy, aconite. If you want, I can give something unusual symptom of aconite also, but I think most of us know aconite. I don't know how many of you must have given aconite nebulous for cough, but then I'll tell you one important symptom of aconite nap. It is coming in my mind. I'll tell you again. Nose. In aconite nebulous, the smell is very acute. First time the patient comes of HMP virus and say, Doctor Sahab, yesterday, my mother was cooking food. The smell of the food was so severe, I could not bear it. That is aconite. That is aconite. In aconite, remember one thing, throbbing in the nostrils. Throbbing. We have throbbing in the heart. Aconite has throbbing in the nostrils. These are symptoms which I remember of aconite nose. Throat symptom, one symptom I always remember aconite, that is tonsils are swollen and dry. If you open the throat, dry means reddish tonsils, pricking, burning and stinging because of dryness. That is the dryness of aconite throat. And if you see aconite, respiratory tract, two symptoms very, very important. The first one is when the patient inspires air, so the patient are very sensitive to inspired air and the cough starts. Stitching in the chest and the cough is dry, hacking cough, worse at night and after midnight. This is aconite which I can remember extempo in the Mater Medica. Okay, Dr. Khatri, okay, we have done Spongia. Valeriana. So see Valeriana, whatever I can remember of Valeriana now. First of all, if you open your Mater Medica and if you see Valeriana, the first symptom it is written on. If you have Allen's keynote, open Allen's keynote, or if you have Boric, open Boric. Valeriana के कुछ symptom बहुत important है. सबसे पहले Valeriana, if you open it, very hypersensitive, or you can say oversensitive, nervous affections, that is Valeriana. Now, Valeriana has changeable disposition, very much like pulsatilla. Valeriana is a person who is, very irritable, hysterical spasms. That is Valeriana. And one symptom of throat of Valeriana, which I remember, is like throbbing of the nostril is present in aconite. Nausea is felt in the nose, in the throat is Valeriana. Nausea is felt in the throat, and there is sensation as if thread was hanging down the throat. That is Valeriana. बस इतने सिम्टम मुझे वेलेरियाना के पता है. Otherwise, Valeriana, normally if I have, I prescribe on the mind symptom, that oversensitiveness, the changeableness, and feeling light as if floating in air. That is Valeriana. उतना ही मेरे को आता है Valeriana, the mathematics of Valeriana. Can you go forward? Or it is already half an hour up. So we are HMP virus. I hope I am able to judge 4 or 5 drugs too, so that you don't make any mistakes. So thank you for joining. I hope you enjoyed it as much as I enjoy sharing my knowledge with you. Thank you. Until next Saturday. Goodbye.